What is your diagnosis?
Okay, so it's a little complicated. So what my doctor describes to me was like a mood disorder, so it's like a bipolar, but it's not so all over the place for no reason. Where it's like most people start at a level playing field, and as they get happy, they go up, and then they go normal, and then they go down, and they go normal. I kind of just will go happy, sad, like no, depending on the situation. Like I just kind of drop and go as it goes, and it's very exhausting.
I'm diagnosed with adjustment disorder and major depression disorder, as well as anxiety, substance abuse.
My diagnosis is depression and anxiety.
How does your diagnosis affect your daily life?
I mean, it affects it in some ways because it's just like, I mean, I live and participate in an industry that's it's very up and down. It's very like based on judgments and based on people's opinions. And I feel like it's hard to consistently have the ups and downs of like this ecstatic industry.
My diagnosis affects me on the daily, when I have to go to school, if I have to go to work, when I'm socializing with friends. Sometimes I isolate myself and withdraw myself from the people that I care about, and I don't always explain to people what's really going on with me.
It makes it difficult to consistently do things that are normal or seem easy to others, like feeding myself either healthy foods or just in general. I can go a couple days without really eating much of anything.
When I was younger, before you realize things, it was more so hard to understand what was going on. So there was a lot more like depression that came with it, and that came with suicidal tendencies and thoughts. And it was just very restricted to day to day because you think you're existing like everybody else, but you're not.
And how has your mental illness affected your relationships personally?
It's affected my relationships because sometimes it's hard to communicate and share my emotions. I have a issue with change sometimes, and I can be emotionally dependent. So sometimes it creates tension in relationships, whether it be friendships or with my partner.
It can also make it difficult to manage my money. I am sometimes in a really good place and I'm saving and I have an accumulation of funds which makes me feel safe. But when I feel down, I love to spend money. I spoil myself with things to do or treats because I'm trying to make myself feel better by getting myself presents.
Does your mental illness affect personal relationships?
I think it does, especially over the last couple of years. It's been a little better because it also came with a lot of substance abuse, and I can't drink like a normal person. I can't just go and have one and be normal. However I'm feeling will be amplified to the highest and lowest degrees.
The negative thoughts, the intrusive thoughts, when I withdraw myself, I can go into a really dark place where suicide becomes an option.
So like I could end up going out with someone and having a full mental breakdown, and then you're having like people who don't understand your traumas and understand your illnesses because you don't want to just bring that up right away in the beginning. So they're seeing like 30 different sides of you and they don't understand which one's you, and you don't want to have that conversation. So it's like it's hard to like let someone in, and it's also hard to date because then loving someone or just liking someone or even caring about someone as like a friend comes with a lot of emotion, a lot of highs and a lot of lows. So you feel everything almost so amplified that it's like you almost don't want to deal with it, so it makes you want to shut down and numb yourself out consistently.
What, in your opinion, is your worst symptom?
Honestly, I think my worst symptom would be, I think it's the low points, because the high points are amazing. I wouldn't change them for anything. When you're riding that high, it's more than a normal person. You feel like you can take over the world, and that's amazing. But when you're low, it's so low, it's scary. And then like you want to turn to things like alcohol and drugs. And like I used to have severe drug problems, and I mean, I had to go to rehab because of it, and it's just hard. And I think that's the worst symptom is the sad part, because you don't know what you're gonna do. And like, I'll go and then I'll end up like wanting to mask it with alcohol or drugs, and then I'll completely black out and have to like wake up in the morning and hope I'm not like in a hospital. I mean, not so much anymore because I don't drink, but the worst part of it is the depression factor, because it's just, your brain will play tricks on you if you don't know how to talk yourself out of it or have the support system. And unfortunately, a lot of people with illnesses don't.
Are you currently taking part in treatment? If so, what form?
I mean, I do go to therapy, and I do just rely on like my family and friends as a support system. I've never done well with doctors. I've never done well with medication, especially being an actress. I can't take the medications that numb you out because I can't feel anything, and that's just doesn't really work with the rest of my life. So I mean, for me, no. I think most people probably should. I'm very lucky in the sense of the strength I have as a person, so I'm really good at managing it when I know what's going on. But I mean, other than a therapist and kind of just like mentally working through it and like meditation and like self stuff, I try not to do the medication form of things.
Okay. And how can we stop the stigmatization of mental illness?
I think it's just, honestly, it's all about conversation. It's all about accepting people for their flaws and for their strengths and just working through them. I mean, I think the problem with having the stigma around mental illness is a lot of people assume that people with these things, they can't persevere, they can't be who they want to be, they can't be more than that. And I feel like they put them on like a lower playing field where they almost coddle them as like a child, or just like they're not have the ability to amount to what everybody else does. And then half the time it's also like, it's something people don't want to talk about. People don't want to be like, they don't want to kind of take it as a real thing. And so you're not really getting the care you need. Whereas like when you have a sick day because you're feeling like you have the flu, you can do that at work, you can do that at school, you can do that anywhere. But you can't have a mental health day in a normal society, which it's not treated like a real illness, but it's also treated like something that's hindering, when it's really something that should just be recognized and cared for, so that everyone has the same opportunities.
Can you think of 1 to 5 words that best describe how you feel deep down?
I think terrified, secluded, misunderstood, electrifying, and yeah, honestly, it's a roller coaster.
Okay, thank you. When I ask, what does, your mood disorder is bipolar, correct?
It is bipolar, but it has a lot more to it than that, because it's usually, I feel like a lot of the time when you hear bipolar, it's the moods that they just go up and down and they coincide for no reason. Mm-hmm. It's more just the way I feel things. I don't have a middle ground. I just have the highs and the lows, and that's it. I ride everything to the most extreme.
And do you have a form of treatment for yourself?
I've done like therapy with psychologists and psychiatrists. I have been to CAMH, and I have been prescribed medicine for like antidepressant medicine to help treat the symptoms that I have.
What is your biggest fear in relation to your mental illness?
My biggest fear is that I won't be okay without medicine, and that I might lose everything that I've fought for in my life, that I could just throw everything away based on doing something impulsive, hurting others or hurting myself.
How do you think we can stop the stigmatization of mental illness?
Communication, open communication can stop stigmatization, understanding, and if there's courses or training implemented in schools or at workplaces, maybe people would get a better understanding of how they can support someone who's suffering.
And can you think of 1 to 5 words that best describe how you feel?
alone, numb, tired, scared, and tense.
In social settings, sometimes my social anxiety gets into my head. I can be out with friends and having a good time, but if I leave the room and I can hear them chatting in the distance, I automatically think that they're talking about me, that they hate me, or that I'm acting stupid or saying stupid things. So it can make me draw back and not be my true self that I want to be. Yeah, I think that's all I can think of right now.
Oh, that's really good. I know you kind of touched on this, but how has your mental illness affected your relationships? And this could be any kind of relationship.
So when it comes to friendships, my group of people who I trust is very limited. I keep my circle small, and even with my small circle, I tend to not open up that much. So I feel really isolated a lot of the time, even though I want to reach out, but I just can't seem to reach out because I feel ashamed to tell these people who I love and who I know love me, to tell them that I am in pain and I hurt and there's nothing that they can do. So they don't always understand why I'm not talking to them. They don't understand why it's difficult for me to get out of bed, or why I can't just do everyday things. In relationships, like romantic, yeah. It's sometimes easy and it's sometimes really hard, depending on what kind of partner you have. I've had partners who just simply don't get it. And I can tell them, listen, this is my depression, this is what it looks like, and it's either you accept me for who I am, or if you don't, you can mosey on. And sometimes they think that they have accepted you, but then you get criticism. They ask you, why aren't you getting out of bed? You're so lazy. And I'm like, I'm not lazy, I'm depressed. And it's hard to create that support system because you don't really think that anyone can truly understand you.
In your opinion, what would you say is your worst symptom?
I think the worst symptom, besides being tired all the time, is when that voice in my head becomes negative. It's hard for me to remind myself that my thoughts are just thoughts and that they are not me. So when I'm extremely tired from the daily fight, that voice tends to get louder and more consistent. And when that voice gets louder, the potential of everything becoming this numb void grows. And when everything feels numb, then thoughts of suicide come up. Like, why am I even alive? Why am I trying? What am I doing? Which resorts which leads to me doing things to make me feel better, which aren't always healthy, like drugs and alcohol, self-harm sometimes. It is hard to fight for yourself when you're fighting yourself all the time, every day.
What would be your biggest fear in relation to mental illness?
My biggest fear is that one day I'll just get so tired that I'll give up on myself. And that if I give up on myself, then other people in my life will also give up on me, and it will lead me to a life of complete loneliness or death by my own hands.
In your opinion, how do you feel like we can end the stigmatization of mental illness?
I think if we just keep talking about it, tell your friends, tell your family, make it normal by acting normal about it. And what I mean by that is just recently, actually, I had a friend ask me, "Where have you been? I haven't seen you out in a while. What have you been up to?" And my instinct was to lie and just shrug it off and say, "Oh, I'm busy, I'm working a lot." But instead, I chose to swallow that down and tell her I've been really depressed for the past couple of months. And it felt good to just say it to another person instead of just saying it to myself in my head. Always fighting, always tired. Abandoned, neglected, alone, and really, really hopeful.
Can you show me what mental illness